and welcome everyone, and thanks for joining us here today. For the next 30 or 60 minutes, we're going to get some insights here from our star and expert, John Higgins, who's the Vice President of Talent Management of Essentia Health. We'll do quick introductions. I'll go ahead and start. My name is Steve Endsley. I'm our Divisional Vice President for our AMN's Workforce Solutions Group. At AMN, we do strive to be recognized as the most trusted, innovative, and influential force in helping healthcare organizations provide quality patient care that continually evolve to make healthcare more human, more effective, and more achievable. In my role in the Workforce Solutions organization, we sit at the forefront of more than 500 hospitals across the nation to help them solve for the workforce shortage through workforce optimization, talent acquisition, talent deployment strategies that are best in class and proven to help lower the cost of labor in both your workforce that is core and flexible to your organization. I've been with AMN for about 6 years, and I've been in workforce or healthcare now for about 15. Spent some time as a social worker prior to my time in staffing and workforce solutions, but I'm really excited to be here with one of our partners in the upper Midwest here, Essentia Health, and John Higgins. And so I'm going to go ahead and let John do an introduction for himself as well, and then we'll talk about some of the topics we look to discover today. I do want to let people know that if you have questions, as Rob said, put them in the chat. We'll answer them throughout. We hope to have an interactive session if we can, but also we'll have some time for Q&A at the end. But John, I'll go ahead and hand over to you for a quick introduction.
Very good. Well, good morning, everybody. John Higgins. I'm the Vice President of Talent Management at Essentia Health. Talent management encompasses everything from recruiting to workforce development, internal mobility, succession planning, performance management, as well as things like contingent labor, flexible labor pools, those types of things. My background is pretty steeped in the talent space, about 30 years in the talent space, 10 of which specifically in healthcare. Prior to that, though, worked for a number of organizations in places like the financial services industry or retailers like Target Corporation, worked at their headquarters, as well as a number of other spots in consumer packaged goods, as well as the software space as well. Real quickly on Essentia Health, to give you an idea of who they are, we're an integrated health system. We serve about 500,000 patients across northern Minnesota, Wisconsin, and North Dakota. Our mission is to make a healthy difference in people's lives. We operate 14 hospitals, 77 clinics, numerous outpatient facilities. We have a team of about 16,000 professionals across that footprint, and an extensive network across the upper Midwest. As we move forward, we're committed to expanding, enhancing our services with the aim of making an even greater impact on the health and well-being of the communities that we serve. So Steve, back to you.
Yeah, thanks. If we want to move forward, I'll show a little bit of the topics that we will speak to today. Some of the things that we have prepared to speak to the group about today is some healthcare workforce insights, as well as creative labor pools, especially within the labor market, and some of the innovative things that John and his team have done. Looking at health retention, which is another piece of your workforce, kind of that enigma that you're figuring out with your workforce and having that retention along with the development in labor pools. And then finally, some of Essentia's strategies, achievements, and innovations that they've had as an organization. The hope here is that we can share some insights from another organization that likely faces some of the same problems in the workforce that many here in Michigan have, but maybe in a different state or different market. At the end of the day, the upper Midwest always has some of the same unique nuances, and especially in the rural markets. So excited to kind of give some outsider's perspective for the group. If you want to move through, as John alluded to, Essentia is a very large organization based out of Minnesota. I don't need to go through the things that he just mentioned again, but here's a look at one of their flagship facilities. I will mention, if anyone has a chance to get to Duluth, Minnesota, their St. Mary's campus up there is a beautiful campus, overlooks the water of Lake Superior. Probably at some point, if you look hard enough, you can see the UP from over there. Probably not, but it's a really beautiful campus, and highly encourage anyone who has a chance to make that trek over. Maybe some of those in the UP, it's not that difficult to get to be able to see it, but it's a great place. So that being said, we're gonna go ahead and cut slides. I'm sure many of you get slides all day, every day. So we want to remove that from the conversation and really just have John and I here speak a little bit more so that you all can hear more from John, some of the innovations that they've done, and also just John's expertise. And again, please make sure to ask any questions as you feel they come in. So one of the first sections we talked about was our healthcare workforce insights. And so, John, you mentioned 30 years of experience in TA, places like Target, places, in the health financial services, but you've done 10 years now in healthcare. How would you say, I'm going to start with one question. How would you say the workforce has evolved given your 30 years of experience? Like, what have you seen as some of the big evolutions in the workforce evolve and how it's evolved? And then I would follow that up with what are some of the unique nuances you see between the kind of corporate space and the healthcare space?
Yeah, great question, Steve. I think just from an evolution perspective over this time frame, and certainly even just over the last 10 years in healthcare, there's been a profound change in both the supply and the demand for the talent that we all need to staff our operations. That's even more profound in the rural setting. I think it's one thing when you're operating in a big metropolitan area like Detroit, for example. It's very different, when you're working in rural parts of, say, the UP, in terms of being able to staff the operations in those areas. And for what it's worth, the largest city that we operate in is Fargo, North Dakota, with Duluth being a close second. But in the grand scheme of things, those are not big cities. Those are arguably, to call them metropolitan areas would be a clear overstatement. And what we're finding in those markets is just a profound, really profound inverse, kind of supply demand curve, if you will. And just being able to keep up and keep our operations fully staffed is certainly a significant effort. Good news is it's job security for me and my team. Bad news is always a struggle, and so something that we have to be really innovative about. The other, kind of just real, one of the things that we'll talk about maybe a little bit later as well is, the focus really needs to be more on, internal retention, if you will, and internal development, internal mobility. How do you grow your talent pool? How do you grow your, the talent within your community? Keep it there, and keep it engaged in the work that you need to do. And that's been, I think, really paramount in what's allowed us to be successful in keeping our operations both running and thriving, if you will.
Yeah, and you mentioned, John, one of the things I think I heard in that, which was very key, was the community piece, right? And when you're talking about rural healthcare, it's very community based, because it's not, to your point, that you have 20 hospitals that you could potentially get talent from or workforce from, like you might be able to in the metro areas. So what I would be curious a little bit more on, if you might want to share with the group, is like what are some of the differences when you think about the urban versus rural healthcare, and what are some of the biggest things that you like, strategies and things you've been able to use to deploy since you've had the chance to work in both? Like, where would you see the members of this group having an opportunity to maybe look at things a little bit differently based off your experience?
Yeah, probably it's interesting, in talking with different partners, vendors, software companies, more and more you're seeing, especially in the technology arena with AI and the rest of it, you're seeing more and more offerings on how do you screen talent out? How do you, get, quickly to the right people, to make the right hire, and get them across the line. In the rural settings, that's just not your problem, right? Screening people out is not the priority. It's screening people in, right? How do we find people that one are, certainly have their appropriate certifications, capabilities, but even further downstream in what we call our gateway careers? How do we get people into healthcare to start and grow them from within? Build their capabilities accordingly. So how can we, create career pathways, and allow people to grow within the org? I think that's really big. So making it's investing in the community, investing in your people, investing in retention. But clearly also, there's a significant need to lean into the community in terms of workforce development. How do you get more people interested in the sciences, interested in healthcare? And so what are you doing to partner with your local educational institutions, elementary, secondary, post-secondary? What are you doing to encourage people to look at the healthcare arena as both a really, certainly a very stable place to get work, but more importantly, a really intrinsically motivating place to work, if you will.
Yeah. With those partnerships you mentioned on like the educational, some of those educational partnerships, how critical are those and what's your reach? I mean, when you think about those different educational partnerships, right, there's probably still only so many universities or trade schools, even within a certain confines of your rural communities. So how do you make sure that you kind of put yourself at the top there with those educational institutions to help in feeding you that talent, and what are the strategies you've used with them?
Yeah, no, great question. And I'll tell you, those academic institutions are our lifeline, right? And so we actually put together, we have very formal academic, what we're called academic practice partnerships that we have with these institutions. And what they are is they're a commitment to one another, right? We commit to those institutions to add value to them, and likewise them to us. But what that looks like, right, is ultimately we're making sure that we're providing counsel to those institutions on curriculum design, and helping with making sure they have the right equipment and labs and whatnot to be able to train our future practitioners. We provide their clinicals, right? So people will be able to come on site and practice the skills that they're honing in school. And then certainly, without question, the opportunity to ultimately have access to those folks,
Mhm.
to recruit and retain them in the communities in which they've chosen to get their education. So rather than seeing the huge departure upon the completion of college of students going back to other cities, we do our darndest to try to keep people in the communities in which we operate and where those schools are located.
Yeah. Yeah. And I think I'd be curious, John, just hearing all the things that you are doing. I have a unique opportunity to sit with a lot of healthcare executives across the nation to hear where the shortages are. Where are you finding in your particular, in today's world, where are you finding that it's even more critical to have those partnerships because of like what areas are you seeing the biggest shortages in your world today?
Yeah, it's interesting. Three plus years ago when I joined Essentia Health, the needs were kind of all over the place, and there's a significant need in the RN space. I'm pleased to report that in kind of our major markets of operation, places like Fargo, North Dakota, Duluth, Minnesota, Brainerd, Minnesota, we've gone from having significant deficits, probably low 20s from a vacancy rate perspective, or high teens minimally when I joined 3 years ago, to having waiting lists for nurses to come join us, right? So
Great.
in those markets, we've flipped the script on nursing, but where we continue to have significant challenge, and where we're placing a lot of emphasis on our current efforts, are really in a lot of the tech careers, if you will. So
Mm.
everything from lab techs to respiratory
Hmm.
techs, in particular radiology. Those are right now probably three of the key areas that we are really investing a lot of time and effort into, to shore up vacancy gaps we have there. And while those gaps aren't nearly as profound as what we were dealing with nursing 3 years ago, they're a big deal, right?
Yeah.
Especially things like lab, and especially things like radiology. Those are some of gateway areas where if you don't have the right people in those roles, you're not, ultimately feeding the rest of the system in
Mhm.
terms of the patient flow that you'd expect further downstream.
Yeah. It's funny when you mention that, John, because having the unique opportunity, I don't sit in your seat, but I sit in the seat to listen to many of you executives, and that is a common theme across the country today. For those of you who are on the call that maybe are nodding ahead or saying, yes, John, I know exactly what you're talking about. It is a very big area of opportunity and trying to help figure out the shortage in those techs because the nursing space has been a little bit better post-pandemic. Obviously, in the pandemic, as you knew, John, it was chaos. I think everyone on the call knows that was chaos during the pandemic, and let's knock on wood that we don't have to deal with that again. But it was something that I think now a lot of health systems have done a really good job shoring up, and now it's figuring out what's next. And it's interesting because you go on those ebbs and flows. There's sometimes it's going to be nursing, sometimes it's techs, right? When you figure out these techs, you probably find out nursing's back to where it needs to go. So it's like you're just kind of bouncing back and forth, unfortunately. So anyway, I think a good opportunity though for us to talk about when you have those shortages, John, is, let's talk about some of the things you do to mitigate that and how do you staff accordingly, right? When you have these shortages, like what are some of the measures when you think about flexible labor, right? And how does that come into play when you think about the rural healthcare industry? Because you don't have, again, big cities where you just have people sitting around. So talk to me more about some of the ways you've created flexible labor pools. What are some of the things you've done to combat those shortages and be able to kind of fluctuate with census in your workforce, even though your workforce may not be expanding?
Yeah, from a flexibility perspective, I think there's a couple key things that we've done, both in terms of allowing more flexibility in the way that we schedule individuals, in the way that we share talent across multiple facilities. But I think some of the other things that we've done. So and this maybe stemmed out of some of the work coming out of pandemic is during pandemic, we stood up, an internal agency in Fargo, North Dakota. And what was unique about that particular scenario was we created a unique, labor pool, if you will, that allowed us to provide a premium rate, flexible type of assignment for nurses in that region of the country. It was a temporary assignment that didn't come with benefits. So there was a different cost structure that was associated with it, or what I should say is it came with very limited benefits. And that was a game changer for us in terms of
Hmm.
allowed us to kind of take out the middleman, if you will, for some of our quote unquote traveler needs. But these weren't traditional travelers. These were people that were a lot closer to home. Typically, you didn't have to worry about folks, getting housing and things like that. They were close enough that they were able to, commute into our operations, and that premium rate was enough for us to be able to, close some significant gaps. That's worked really well for us. We've continued with that model in the Fargo area, and have looked about how we can deploy it elsewhere into some of our other disciplines, like a radiology,
Hmm.
like a lab, those types of things. I anticipate that we'll continue to look at those types of flexible pools. And the other thing I would just make note of is the being able to leverage even kind of some remote workforce stuff, right?
Hmm.
Where we're doing some pretty cool things, in particular in nursing, with remote nursing, both in terms of at the point of admitting, during things like patient monitoring, as well as at point of discharge, being able to use remote-based nurses, leveraging iPads in our operation to be
Hmm.
able to have another flexible resource available, that can work with the patients and allow us to do a better job of managing patient flow.
Yeah. Well, you mentioned there's two things I want to follow up with because there was two things I think that are very interesting. One is your internal agency. We obviously that had an opportunity as your partner to help you with kind of the some of the logistics of that, not knowing you all did a lot of that work, but supporting you in doing so. What were some of the biggest things you had to think of or the learning lessons you might be able to have? Because I do still think a lot of organizations are considering that internal agency or have one. And we've seen, in the pandemic, it was a lifesaver. And
Yeah.
some people have come to realize like, hey, it's maybe not as much of a need given where we're at. So what are some of the learning lessons or just kind of things you would share with people on this call when you talk about how you all built that and where it was 5 years ago versus where you are with it today and what you see future forward in that?
Yeah, I think it's, one of the things that's probably really important to think through is, what kind of, from a market perspective, what kind of, premium rate is going to be necessary to get somebody across the line, and what's sustainable for the organization to be able to make that
Hmm.
work from a cost structure perspective. Obviously, one of the ways that, you can offset, salary costs is benefit cost. And so, thinking through what are the unique benefit packages that you might, build accordingly to meet that need for a temporary worker that are not cost prohibitive when piled on top of the premium salary you might be offering. The other thing you get to be just really acutely aware of as well is there's people that will really love that model, right? They don't, for whatever reason, they might not need your traditional benefit set, and they'll want to hang around longer, right? And so
Hmm.
we worked really closely with our legal counsel internally, and I should probably put some kind of note here, right, that I'm not providing legal advice, but the our legal counsel felt that for somebody on a temporary status ought not stay for too long based upon ACA requirements for the types of benefits that might be made available to folks. And so, after a period of time, less than a year, I'll leave it at that for the moment. If somebody chose to continue working on a temporary basis, we would we actually worked with AMN to come up with a different payroll servicing model that allowed those employees to shift over to a different, employer of record, if you will, and continue working in that model for an extended period of time, with us without having to depart. And while there was a while there is a slight premium to doing that, to having somebody do manage the quote unquote payroll servicing for a employee. The offset was, we were able to retain that talent for an extended period of time.
Hmm.
For those that chose not to go down that path, they had the opportunity to join us. And what's been really great is those that came over on a temporary basis for our internal agency learned what our operation was all about, learned what it was like to work for us,
Yeah.
learned about our culture and how we treat people. And we converted a huge number of those nurses to become full-time team members with full benefits and the rest of it. Obviously, their base salaries changed back to the normal range at that point, but they were happy to do so accordingly because we pay very competitively from a market perspective.
Yeah. Yeah, and I think as you're thinking of those pools, and I know we're going to talk a little bit in retention here in a minute. One thing I wanted to ask for you too, your role's in HR, right? So,
Yep.
but you have stakeholders internally that you have. I mean, you don't report to, but you do report to, and I'm sure many other HR leaders who may be on this call have that. What's the importance? And kind of talk to me about the importance of a good um, kind of collaboration with those stakeholders like your CNO or your
Yeah.
CMO or your
Yeah.
your leaders of different departments and how does that play a role and not only and this segues into the retention piece, but how does that play a role in making sure you're creating effective, flexible labor pools to meet your staffing needs, but also the retention piece?
Yeah, it's absolutely critical, and I'm very thankful to have the opportunity to work with some of the key leaders that I get a chance to work with. Everybody from our chief nursing executive to our CMO, and certainly a lot of our key shared services leaders, our key operations leaders, but coming up with innovations, problem solving together, right? Not you don't have to be the smartest person in the room. In fact, if I'm
Hmm.
the smartest person in the room, we got problems, right? So surrounding yourself with folks that have great ideas, and then operationalizing them. I
Right.
love nothing better, than brainstorming with some of those key leaders on, what are the problems we're trying to solve and what might work, right? We've got some really neat things that we've come up with. We had a neat program that one of our executives came up with a number of years ago, that we refer to as education to employment, where we sponsor students, in particular in tech schools, to as they're going through school, help them with their tuition, help them with their books, obviously help them with their clinicals, those types of things. And then with a work agreement, they come to work for us. But we've kind of flipped the script on that, and we've created something internally, rather than what we refer to as E to E for education to employment. We have internally we refer to it as Elevate You,
Mm.
and so that Elevate You capability very similarly offers our internal employees, that are interested in those career tracks, right? So those gateway career holders that want to continue to grow and step up, we'll send them back to school, and we'll assist them with their tuition costs, book costs, and even with some supplemental cost of living type expenses to make sure that they can get through their training, and get back into our workforce, working in these critically difficult positions to fill. And all of that stemmed from conversations with these leaders.
Hmm.
And you think about all the different times where you've got people that are upgrading skill sets as they're doing so. If you can invest in them, and create a model that allows them to return in a role of greater sophistication, typically, if you provided sponsorship, they're more than happy to provide additional work commitment to do so.
Hmm. Yeah, and I think as you talked a little bit more, about kind of working together with those peers, I will share, one, I'll commend you and the team that you've always done a great job, I think, making sure that you have that continuity, because I think one of the things I can see too from my seat, particularly with the number of system execs I get to meet with across the country, is not every organization is that cohesive. And I think that's one of the bigger downfalls I do see when you think about managing and mitigating workforce shortages, rural or urban, is if that cohesiveness between your talent management, your talent acquisition, and then the rest of those stakeholders is not, fully there and intertwined, it becomes problematic for sure. So that center of excellence is incredibly important. You mentioned one thing. I know you and I've talked. We've worked together for some years now, and one of the things that when you and I talked, as we kind of prepared, is kind of your retentionist program as well. When you think about some of the achievements that you've been able to achieve there at Essentia, can you share some of the things you are most proud of, and some of the things that you've
Yeah.
been able to kind of achieve in your time at Essentia, again, focusing a little bit more on that retention aspect right now, because I think that's one thing you guys have excelled really well at.
Yeah, probably, as you think about, as I noted earlier, retention is the name of the game. That being said, our nursing leader, our nursing executive, in conversations that we were having with her, conversations she was having with her leadership team, they pivoted very quickly to, we don't have a recruiting issue. We've got a retention issue, and
Hmm.
we need to focus on getting doing everything we can to wrap our arms around these nurses that are choosing to join us, both new in career, right? What she likes to refer to as newly experienced nurses. For what
Hmm.
it's worth, she does not like referencing new grads as new grads. She likes referencing them as newly experienced, right? They've got a different experience set than others that work
Hmm.
there, and there's value to that experience. But also the experienced folks, but really wrapping our arms around them and make sure we're setting them up for success. And in doing so, we read about a particular capability that I believe it was a nursing system on the West Coast had pioneered this concept of a nurse retentionist. And we have put in a couple of these roles into our system. And they partner with leaders that, and they look for hot spots in terms of where we may have particular retention concerns or areas with slightly higher turnover, and go in and spend time with those leaders and with those employees, and figure out, if you will, what's going on, help folks, navigate, accordingly through that. But really with a profound focus on, are we doing the right things to ensure that people will want to stay, right? Are we,
Hmm.
are we, providing the appropriate flexibility? Are we having the right recognition, taking place on the units? Are we, having the right developmental conversations? Are we helping people with the career paths they want to be on? If they're in the wrong assignment, are we working to get them onto a different assignment, right? If, especially these newly experienced nurses, right? You can
Hmm.
have folks join and be convinced that they want to be in labor and delivery, or they want to be in ICU, or they want to be in a particular unit, and they get on that unit, and kind of once they're trained in and ready to go, and they realize, oh my God, right? Like,
Hmm.
I don't want to do this. This is the wrong.
Yeah.
I didn't realize it would be like this, right? And
Yep.
historically in those settings, your typical newly experienced professional, might just go look somewhere else. It's easier to go
Yep.
look somewhere else than it is to acknowledge I've made a mistake and can you help me navigate to a different spot?
Yep.
We've made a very conscious effort to make it okay to fail, make it okay to realize that you're in the wrong spot, and with the ability to raise your hand and say, "Help me find a better spot."
Yep.
Our turnover within our newly experienced nurses has gone from mid 20%, right? So think roughly 25% turn annually taking place in that newly experienced area. So 1 out of 4, we're sub 10% at this point. I think we're around
That's great.
right around 6 or 7% at the moment. And all of that is certainly, I can point to the retention as being a key, catalyst to making that happen.
Yeah. There's a lot of things you just said that I think are very insightful. You talk about just the language used. I mean, I have 2 kids and I tell them all the time, the way you communicate one word can make a big difference for one person. And so I think communication is key, it especially sets the culture for people to show the level of respect you have. So I think that's important. And it's funny you mentioned about, hey, a nurse comes in and wants to go to L&D and realizes they don't want to go there. Again, I'm a social worker of trade. That's what I started in. I'm very proud of the work I did for the time I did, but I think a lot of us, we end up thinking we're going to school for something and that's what we want to do for the rest of our lives. And, you get in the field and you're like, oh, actually, I kind of want to do something a little bit different. Like this isn't the perfect match for me. So, I can relate to that myself personally, given my social work background and where I am with you today. So, very insightful. But I do want to ask. You mentioned about kind of the hot spots of turnover.
Yeah.
What are the data points you look at, and how do you kind of evaluate if there's that hot spot, or even the data points you're using in your workforce as a whole? Like, what are
Yeah.
some of the things that you find most critical to the success of your role?
Yeah. Well, and it's not as rocket science as it sounds, right? Simply running retention and turnover reports, and having being able to zone in on what are the hot spots, in particular where you've got scale the focus, if you will, right? So if you got a department of 4 people and one person turns over, it looks at 25% turnover in that department of 4 looks
Yeah.
really horrible. It's very different when it's a department of 200 and you've got 25% turnover.
Yeah.
And not to say, right, like if that 1 out of 4 is neurosurgery, you can have a problem. But the fact is, focusing on where the scale of opportunity is critical. the other things that we have identified, Steve, that are very strong correlates to turnover, kind of predictive correlates are things like, are you having the right kind of development and performance conversations with your team? We have an
Hmm.
expectation that you have 2 development and performance conversations a year. It's not that hard, right? It doesn't sound like
Yeah.
that big of an effort. Now, mind you, in certain disciplines, we all know that the span of control is pretty significant. You can have a nurse leader that has 100 reports, and it's a task to make sure you get all those development conversations scheduled and held throughout a given year. Because now that means you got to have 200 conversations over 52 weeks. That's essentially a
Yep.
conversation a day, right?
Yep.
So and if you're not really planful about that, that can be a problem. That being said, so are you having the development conversations? And we can track that. We track that with Workday. We also track things like we have an employee engagement survey, and we can look at participation rates, right? What's the participation rate? Tell us about the engagement on your team. What is the employee referral rate? Tell us about the engagement on your team. And then lastly, one of the other things that is a really big deal is we, a couple of years ago, invested in a recognition program system, if you will. And the number of times you are recognized for doing a good job, right?
Yep.
Through that system is a correlate to whether or not we will retain you. So we look at all of those things. Those are all kind of different levers, and we've built some, reports with our business intelligence team that can help us zone in on, one, where are the hot spots based upon just straight up turnover, but then where are the hot spots that are likely to develop where maybe the turnover numbers aren't showing yet, but the levers aren't being thrown in the right direction.
Hmm.
And how do we get to those leaders, help them understand, what their opportunity for improvement is, and what that should mean in terms of their ability to retain, the high performing employees that they want to, keep on their squads. So
Yeah.
yeah,
Yeah, it's funny you mentioned one thing because even at AMN we have this our chief people officer, but that culture of recognition, right?
yeah,
It's you kind of have to know what people's languages are, right? What is it that gets them ticking? And it's not always having to go down to dollars and cents. Sometimes it's simply like, hey, we want you to know and everyone to know how great of a job you're doing. And so, little things like that and the retention and the data points that you talk about are critical, I think, to the success of any organization, whether it's healthcare or non-healthcare. But as a leader of individuals myself, that's one of the big things I always try to instill. So I can completely relate to that. Um, and we're getting close here. I got one more topic that I want to make sure I get addressed, John, and then we'll probably have some questions. I think one came in the chat. If you don't mind, I'll finish the topic and then we'll go to that one.
sure.
But you mentioned this earlier. We want to talk about talent acquisition innovations, right? So, you mentioned a lot of things like remote work at one capacity or a little bit earlier today. Can you just give me a little bit more about some of the innovations you have today when you think about your talent acquisition hat, and what is it you're doing when you think into the future of how you're going to continue to mitigate these shortages?
Yeah, yeah. Well, I think probably what I would point to, is really more, talent acquisition innovation today. I honestly think is really in healthcare, in likely in a number of other industries as well. But I'm speaking to a group of peers right now, right? It's really all about workforce development. It's about getting upstream, right?
Hmm.
Especially in rural healthcare. What are you doing to engage your community in healthcare careers, right? And what are some of the unique, talent pools that you might be missing out on? So one is, how do you make sure you get kids thinking about, healthcare careers, science
Yeah.
careers earlier? But then, then there's the workforce that's already mature and ready to go. Think about folks that are, the career rebounders, or maybe it's, Steve, maybe you're about ready for that midlife crisis, and you want a career with more purpose, right?
Yeah.
How can we engage you, right?
Yeah.
To consider a shift, into the healthcare workforce. So we're very intentional about creating. So not just your traditional internship, but what we refer to as we have job shadowing and career explorer capabilities for people
Hmm.
to be able to kind of take that next level look, not just at a student level, but as a mid-career professional level, if you will.
Yep.
I think those are innovations that are really very critical. But also some of those unique pools of talent that you might not be tapping into yet, right? So whether it's new American talent pools or second chance talent pools, differently abled talent pools. We got a really cool program in North Dakota with an organization called Mindshift.
Hmm.
Mindshift is an organization that works with people that are on the autism spectrum,
Hmm.
um, and helping them find meaningful careers, if you will. And they have worked with us to identify some different career options, and one of which we're having incredible success with is sterile processing. Right?
Yep. Hmm.
A job that is incredibly important, incredibly detailed, and candidly not particularly easy always to fill. You know, I don't know that we've had to fill a sterile processing job in the Fargo marketplace in the last 18 months.
Yeah, that's
And
great.
it's because we've got great talent, differently able talent that's in there doing the work, loving the work, and it's allowed us to focus on other areas of the organization because that talent pool we weren't tapped into previously has shored up a gap that we previously had a really hard time taking care of.
Yeah. Well, John, you hit two spots for me. One, I'd call you if I was going back into the field. Two, that's actually the population I served when I was in social work, was predominantly people who were, high risk or trying to find work. And so I was doing a lot of those career services and soft skills. And I'm actually a member, for those who haven't worked with them, but like the Division of Voc Rehab, right? That's another area of
Yep.
opportunity to find some of those individuals. And I was a recipient of the DVR as a kid, and they helped me drastically and probably helped form to where I at least started my career in healthcare. And I'm sure one day we'll end up back there working at, in the same capacity I did, about 10 years ago. So, I agree with you. Those are some great avenues and opportunities. And I think areas that not everyone thinks about when they think about how do I source for my talent. And to your point, when you're in the rural communities, you've got to get as creative as you can and maximize what you can. So kudos to you all for that. Um, we have about 15 minutes, and I know you and I, John, wanted to save some time for the group. So I did see one question in the chat, so I'm gonna pick this one up, John. It states there's a question that asks about paying employees their regular wages and benefits while they go to school, and then they're moving them from a non-patient role in organization to skilled patient-facing role. So I think the question there is that something y'all have done? And maybe there's a question for the others in the chat that if they want to answer as well. But John, I don't know if you want to go ahead and take that to start.
Yeah, so we actually up until this point, right? What we've done is gotten people into lower FTE roles, obviously, where they're able to pick up, whether it's PRN or otherwise, continue to pick up shifts while they're in school, and get their kind of associated wages with those at the same rates they were previously. But the question at hand is actually one we are looking at in great depth right now. Is for some of our really critical roles, what we refer to as our vital jobs. Think of this as your top 10 list. That you need to focus on likely for the next 2 to 3 years. For those that are willing to pursue those particular paths, what's our willingness to your point, both carry benefits and make sure that they're kept whole from a salary perspective while they attend school. We haven't landed the plane on that one yet, but it is something that we anticipate to land the plane on here shortly. So it's a great again, smarter person in the room question and something we're working on doing accordingly.
Awesome.
Was there a second part to that question, Steve?
Just I think it was the question was moving from non-patient role in organization to skilled patient. So I'm assuming they're
Yep,
working on
yep, yep,
upskilling right now. That's kind of
yep.
the way I would read that. Trying
Perfect,
to get them
perfect.
into a more relevant role or a higher need role from where they're at today.
Yeah, very good. No, great question. And I hope maybe if I'm asked back in a future year, hopefully I can talk about the great success we've had with that. So
Yeah.
we haven't quite landed the plane on it yet, but it's actively in discussion.